Click on your patient's name, Emma Dale. Check that you have the correct patient in the patient banner. Click on the Order Entry hot link. A range of department tabs will appear. We're going to click to select endoscopy. Remember, this is only a representative sample of the tests available in the live system. Click on Endoscopy. Click to select Diag Gastro Diagnostic Gastroscopy. Then click on Add Order. The date-time field will default to now. Click the priority drop-down. 3 options show: HSC 205, pro forma patients only, urgent and routine. If you select HSC 205, please also complete the additional cancer pro forma upgrade in Advantis. We are going to click on HSC 205. Select HSC 205. Click the Procedure to be undertaken by drop-down. This message box will appear. Select Consultant Only if you have a valid reason. We will click on OK. Click OK. We have to click back on the Procedure to be undertaken by drop-down arrow. Select Pooled. Next, click the If the patient does not have capacity drop-down arrow. This message box will appear. We can read any important messages and then click on OK. Click OK. Click back on the If the patient does not have capacity drop-down arrow. Select No Form 4 required. We will continue and click the Is the patient on NOAC drop-down arrow. This message box will appear. We can read any important messages and then click on OK. Click on OK. Click back on the Is the patient on NOAC drop-down arrow. Select No. For this field, it is important to remember to check the case notes to see if the patient is booked for an outpatient gastroscopy. This patient requires an urgent gastroscopy whilst as an inpatient. By indicating that the patient is already booked for an outpatient gastroscopy, you can prevent the patient being sent another appointment when they will have already had the gastroscopy done as an inpatient. Click the To be performed as an inpatient/outpatient drop-down arrow. Select Outpatient. Click the Has patient had previous upper GI surgery drop-down arrow. Select No previous upper GI surgery. Click the Is patient diabetic drop-down arrow. Select No, not diabetic. Next, we click into the Reason for Referral Other Information text box. We will enter some information here for you. Click OK. The order is placed in a holding area. This is your last chance to check what you have completed. Once you are ready, we can send the order. Click Send Order. Select the bleep number field. Important: your electronic signature appears. If this is not your username in the live system, then you will need to delete the order and log back in as yourself and reorder. Continuing is the equivalent of forging someone's signature if you continue. Click in the bleep box to type in your contact number. In this example, we will do this for you. Click on OK to send the order. After this order confirmation, the order will automatically print out in the endoscopy department. Remember, if the gastroscopy is an emergency, you will still need to go to the endoscopy department and discuss the request with department staff. Click OK. Close the order entry screen. When finished, do not forget to deselect your patient using the patient banner. Click Deselect.